Hey, Dr. C here with you. Let's get a good understanding of thyroid health. I want to help make sense out of symptoms and their solutions. So for starters, let's talk about what the thyroid does. This is super important. The thyroid gland controls three big parts of your body's chemical processes: energy production, repair, and then conduction of nerve signals. So these are the big things that it's involved with. And that means that energy production, it's just that. Are you making energy or is it being stored? Is it just being stored as body fat? Tissue repair, skin, hair, nails, tendon, ligaments, all these things wear out. And as long as they're repairing at a rate that's proportionate to how quick they're wearing out, it's all good. But if they're repairing too slowly, it's not good. They become unhealthy and thin and brittle and more apt to be symptomatic. And then nerve conduction, that's about how well you can move, whether there's pain in the extremities, and then how well the brain works. Mood, memory, enthusiasm, these things all tie into nerve conduction. So what causes thyroid problems? That's our next topic to talk about. Well, and please know that by thyroid problems, I'm referring collectively to autoimmune thyroid disease, hyperthyroidism, greater risks for thyroid cancer, nodules. These things have pretty similar causes that give rise to them. Now, for starters, I want to make a distinction between causes versus contributors. What causes something and what's a contributor? I heard a distinction about like a donation versus a commitment, kind of like that. Someone made that distinction at a ham and egg breakfast, the chicken made or contribution versus commitment. Yeah, contribution and commitment. So ham and egg breakfast, the chicken made a contribution, the pig made a commitment. And yeah, it's kind of like that with causes and contributors. So some things are completely central. And a cause means that if that problem is there, thyroid disease can happen no matter what else is going on. But what I'm calling a contributor, that's something to where if someone's prone to thyroid disease, they can make it a little more apt to happen now rather than years down the road. But they by themselves do not cause thyroid disease. They don't make it happen all by themselves. And I make this distinction because if you're spending time reading blogs or watching videos or social media about thyroid treatments, you'll find many talk about these big, long list of root causes. And the idea is that there's a list of 50 of them, and you've got to go through all 50 and find which one and correct all 50. And eventually, if you get to yours, everything is better. And that's kind of how it plays out. And here's the thing, any way in which your health is negatively affected is relevant to your health globally. And all these problems that are talked about as root causes are all possible problems for some people for all things. But there's very few that really are causes of thyroid disease. So stuff like this includes mold, dietary gluten, stress, leaky gut, ingestion of toxins, low level of nutrients, hormone imbalances, infections. And think about it, these are things that affect a lot of people. And nearly all of them do not go on to get thyroid disease. Many have no symptoms. Some do get symptoms in various ways, but they're not things that everyone who gets stress, for example, not everyone who gets stressed gets thyroid disease. We all have stress in some way. Not everyone has thyroid disease. So these are contributors, and these can be totally relevant along your journey. But the important point is to realize what the causes are, because one of the causes we can do something about. And causes, again, these are things that can trigger it all by themselves. And really here, we just think about four things. We think about genetics, and that actually ties in the all others as well. So thyroid disease is highly, highly genetic. And we know this among twin studies. If one identical twin has thyroid disease, the paired twin has about a 65 to 75% chance of developing it as well. So genetics are huge. Now, interwoven with genetics are gender. Most of the genes that correlate with thyroid disease are on the X chromosome. Women have two sets of those. So women have a greater risk of developing thyroid disease. And then also age. Now, the more ways in which genetics can trigger a problem, in many cases, the more years we live, the more chances we have for things to go wrong. Just imagine you've got a car with a, not great set of tires. Maybe they're okay, but not great. You could probably get by puttering around town just fine. But a cross-country trip might not work. And that's how age plays into a lot of genetic conditions. Now, the last one, many studies have argued that this is the one thing that's truly causal for thyroid disease that we can control, and that's our iodine exposure. Now, this is also interwoven with our genetics. pretty much all the genes that are correlated with different versions of thyroid disease, they're genes that are known to correlate with how we metabolize iodine. They affect enzymes called deiodinase enzymes. And what happens is that these genetic variations create a narrower iodine tolerance window. Anyone can get too much of anything. We can drown from water. You can drink too much water and die from that. And of course, we could die from dehydration. So even something as non-toxic as water has this safety window. Well, iodine has a narrower safety window than pretty much any other nutrient. And then with genetic variation, that window may be narrower. And so the main point about it is that people with genetic issues can easily go above that upper limit in the modern world. And when that happens, that can be a big driver for autoimmune thyroid disease. Most common version of that is Hashimoto's. If that's bad enough, that can slow the thyroid, and that leads to hypothyroidism. Now, with small variations, the same thing that can give rise to Hashimoto's can give rise to Graves' disease. And in fact, a lot of people who have antibodies for Hashimoto's or Graves' have one for the other as well. And there's even talk in literature about treating them as one disease with different manifestations. So they're both highly genetic, and both can be triggered by even the slighter excesses of iodine. And with the genes, the reason that not everyone has the same tolerance is because we've got different genetic adaptations. Some people, their ancestors were well adapted to being in coastal areas. And all iodine comes from the sea. So if you're living by the ocean and your diet has a lot of food you can get, shellfish, seaweed, a lot of fish from the ocean that were recently caught, you'll always have a fair amount of iodine in your diet, and sometimes a lot. And really high amounts of iodine create a lot of free radicals. And so someone like that, their thyroid adapts to always knowing that iodine will be there and being ready to block it and break down those free radicals. Now, other people had more evolutionary time farther away from the ocean, more inland, more in mountainous areas. And in those areas, remember, the iodine comes from the ocean. So based upon how the rainfall came from the oceans, their soils may not have had a lot. And some had problems because there was far too little. But most had to adapt to lower iodine environments. So in doing so, they got really good at being able to pull in iodine and concentrate it. But to do that, they had to let go of the ability of neutralizing extra iodine. So that's kind of where we are in the modern world. The genetics that were adaptations to lower iodine environments are problematic now that we're generally iodine sufficient, and some people get a slight excess. So when the intake is wrong, that can trigger the autoimmune response, which gives rise to hypothyroidism via Hashimoto's or hyperthyroidism via Graves' disease. And these same things can also be a big part of what causes structural thyroid disease. The main things there are nodules, goiter, and cancer. Now, they're not the cause of all. Iodine intake being wrong is not the cause of all thyroid disease, but of the four things that are causal, it's the one thing that's often a strong cause that we can control. Nodules, about 5% of people get nodules, and some now it's from this same thing of extra iodine. Others, it can be simply related to changes in body weight, extra body weight, high insulin levels. And for some, not really a clear reason behind that. Goiters are also quite prevalent. Nodules, so I said 5%, so nodules can show up. Goiter is the one that I meant to say for 5%. And structural disease is a similar problem as well. Structural disease correlates with nodules, goiter, or cancer. Goiter is where the thyroid itself enlarges, and this affects about 5% of people. It's related to sometimes just randomness. There's not a clear reason for many who develop goiter. Sometimes the wrong iodine amounts can be a trigger. Nodules are very common. In fact, most people who have thyroid disease, the majority of adults with thyroid disease have nodules. And the risk for nodules is about the same as one's age in years. So, being 56, I've got about a 56% chance of having nodules if I had thyroid disease. And then thyroid cancer. So this is the most rapidly increasing type of cancer in North America today. Very common. And it is also known to be driven and related to risk of unusual iodine exposure. So that's the main things that give rise to it, the main types of thyroid disease. The main thing I want you to hear, though, is that all of these things are things you can do something about. And when they do cause symptoms, the symptoms can be managed and can be improved. So always know that if you're not feeling as well as you did before the diagnosis, there's an opportunity. There's a chance that things could change. The right diet that's done thoroughly, helpful nutraceuticals, these can be a big cornerstone of treatment. But never give up on the health that you really deserve and missed and had before, because that's possible for you. All right, Dr. C with you. Take great care. We'll talk again really soon.